I have used size 1 dilator, sometimes size 2, but then I get stuck there. What am I doing wrong? Hey, I'm Dr. Darshana. I am a vaginismus expert, and I am trying to answer all the questions that I commonly get from patients, right? It's important to understand that vaginal dilators come in different sizes. What I have seen is size 1 or 2. They're generally small, like size 1 is the size of a finger, size 2 is a little bit bigger. Inserting size 1 or even size 2 dilator, the biggest hurdle is more fear, right? Like people who have penetrative pain, people who have vaginismus, have a combination of like fear around where does this really go? What if I do it wrong? Am I going to break something? I don't even know how to do this. And the other part is like, I feel very ashamed that I have this problem. So when it comes to size 1 or size 2 dilator, the biggest thing they need to overcome is this emotional barrier, right? This mental barrier of fear, shame, lack of knowledge, what have you. But after that, size 3 and 4 are actually bigger sizes, right? So it's not just about the emotional fear of doing this thing, but also actually needing space, actually having muscles that are flexible enough so they can yield. When you think about vagina, it's like a tube and pelvic muscles are kind of all around it, right? So if the muscles are tight, the tube is not able to expand. For size 1 and 2, because they're small, you don't really need the muscles to stretch or the tubes to expand. But if it is size 3, 4, or when you're using a speculum for a doctor's exam, or if you're attempting penetrative intimacy, we actually need these muscles to stretch and yield so the vaginal canal can have space. That's why size 3 and 4 are not as easy on a DIY situation, because some people require reaching those muscles and finding tight areas in those muscles and releasing tension in those muscles to then make the next step forward, right? Some people are able to do that by using tools like a wand to get in there and release tension in the pelvic muscles, and others feel very intimidated by it because think about it. You are already dealing with pain. You don't know the anatomy and what goes on there. And pelvic wand seems like pretty scary, like a big tool that needs to go inside and you need to know how to move it, and it can feel very scary. So people often feel stuck. So if you are thinking, why can I get size 1, even 2, and then get stuck? That's because you were able to very successfully work through the initial emotional mental barriers of just putting something inside, and that is a big deal. So I'm happy for you. I'm proud of you. Next step requires also working on the pelvic muscles to then open up space, right? Imagine it like an inverted vase. Muscles are the vase and the vagina is the narrow neck, right? If the vase is coming into the neck, we need to stretch and open those muscles so the pathway would be clear. And that's where we need now more tools like a pelvic wand and ideally an expert like a pelvic health PT, just so that you are doing few things that are actually effective and helpful versus getting burnt out, feeling hopeless, tired, trying all the million things that may or may not work, right? The fastest way to success is always outsourcing the expert.